My name is Dr. Lisa Martinez, and I have been working as an obstetrician-gynecologist at Cedar Valley Medical Center in California for 10 years. In that time, I have delivered over 1,000 babies, handled countless high-risk pregnancies, and seen every possible complication that can arise during pregnancy and childbirth. But I had never encountered a case quite like Rachel Morrison. Rachel was 28 years old, unmarried, and worked as a graphic designer for a small advertising firm. She came to my office on a Tuesday afternoon in September, referred by her primary care physician for what he suspected was an undiagnosed pregnancy. "Dr. Martinez," Rachel said as she sat down in my examination room, "I need you to understand something from the beginning. I am not pregnant. I cannot be pregnant. I have not been sexually active in over 2 years." I looked at her referral notes. Her primary care doctor had noted weight gain, nausea, missed periods, and what appeared to be fetal movement in her abdomen. These were classic signs of pregnancy, but Rachel seemed absolutely certain of her denial. "Rachel, I understand your concerns," I said gently. "But sometimes pregnancies can occur even when we think they are impossible. Can you tell me about your symptoms?" "That is just it," Rachel replied, looking frustrated. "I do not have pregnancy symptoms." "Yes, I have gained some weight, but I attributed that to stress eating from my new job." "Yes, I have been nauseous, but I thought it was from the anxiety medication I started taking 3 months ago." She paused and looked uncomfortable. "And yes, there are sometimes movements in my abdomen, but they feel more like muscle spasms or digestive issues." I made notes as she spoke. Rachel seemed intelligent and articulate, but denial was not uncommon in cases of unplanned pregnancy, even when patients were being completely honest with themselves about their sexual history. "Rachel, when was your last menstrual period?" I asked. "That is the thing, Dr. Martinez. I have never had regular periods. I have a condition called PCOS, polycystic ovary syndrome, and sometimes I go 3 or 4 months without a period. So missing periods is normal for me." This was plausible. PCOS could indeed cause irregular menstruation, and it could make it difficult for women to recognize pregnancy symptoms. "I would like to run some tests, starting with a blood pregnancy test and an ultrasound," I explained. "Even if you are certain you are not pregnant, these tests will help us figure out what is causing your symptoms." Rachel agreed, though she maintained her insistence that pregnancy was impossible. "Dr. Martinez, I know my own body. I know my own life. I'm telling you with complete certainty that I have not been with a man in over 2 years." The blood test results came back within an hour, and they were conclusive. Rachel was definitely pregnant. Her HCG levels indicated she was approximately 32 weeks along, which would make her about 8 months pregnant. When I called Rachel back into my office to discuss the results, her reaction was not what I expected. "That is impossible," she said, but she was not emotional or defensive. She seemed genuinely bewildered. "Dr. Martinez, there has to be a mistake with the test." "Rachel, I ran the test twice to be sure. Your HCG levels are extremely high, consistent with a pregnancy in the 3rd trimester." She shook her head slowly. "But that would mean I have been pregnant for 8 months and somehow did not know it. How is that possible?" "It is rare, but it does happen," I explained. "It is called cryptic pregnancy. Some women do not experience typical pregnancy symptoms, especially those with PCOS or other hormonal conditions." But even as I said it, I was having doubts. Looking at Rachel, she did not look like a woman who was 8 months pregnant. She had gained some weight, but she was not showing the obvious belly distension that would be expected at 32 weeks. "Let us do the ultrasound now," I suggested. "That will give us a clear picture of what is happening." As Rachel lay on the examination table and I applied the ultrasound gel to her abdomen, I expected to see a nearly full-term baby on the screen. What I saw instead made me question everything I thought I knew about pregnancy and human biology. The ultrasound showed a fetus, but it was unlike anything I had ever seen in 10 years of practice. The baby appeared to be perfectly formed and healthy, but it was surrounded by what looked like a second amniotic sac, and there were structures in Rachel's uterus that should not exist. "Dr. Martinez," Rachel said, looking at the screen. "What am I looking at?" I honestly did not know how to answer her question. I stared at the ultrasound screen, trying to make sense of what I was seeing. In 10 years of obstetric practice, I had performed thousands of ultrasounds, but the image in front of me defied every textbook I had ever studied. "Rachel, I need to get a clearer image," I said, adjusting the ultrasound probe and changing the settings on the machine. "What I am seeing does not match typical pregnancy anatomy." The fetus itself appeared normal. Approximately 32 weeks gestational age, good heart rate, proper limb development, and normal organ formation. But the environment around the baby was completely abnormal. Instead of one amniotic sac, there appeared to be two distinct membranes surrounding the fetus. The inner sac looked normal, but the outer membrane was thicker and had a different texture than anything I had seen before. Additionally, there were what appeared to be additional organs or structures in Rachel's uterus that had no medical explanation. "Dr. Martinez, you are scaring me," Rachel said, watching my expression as I studied the screen. "What do you see?" "Rachel, I'm seeing a healthy baby, which is good news," I said, trying to stay calm. "But there are some anatomical features that I cannot explain with my current knowledge." I pointed to the screen. "Normally, a fetus is surrounded by one amniotic sac inside the uterus. But your baby appears to have two sacs, and there are additional structures that I cannot identify." Rachel sat up partially to get a better view of the monitor. "What kind of additional structures?" "That is what I am trying to figure out," I admitted. "There appear to be organ-like masses connected to your uterine wall, but they do not match anything in normal pregnancy anatomy." I continued the ultrasound examination, documenting everything I saw. The more I looked, the more confused I became. Rachel's uterus had somehow developed additional chambers or compartments, and the blood flow patterns were unlike anything I had ever observed. "Dr. Martinez," Rachel said quietly, "I need to tell you something that might be relevant, but you are going to think I am crazy." "Rachel, at this point, any information might be helpful." She took a deep breath. "About 4 months ago, I started having very vivid dreams. Not normal dreams, dreams that felt more real than being awake. In these dreams, I was in some kind of medical facility, and there were doctors performing procedures on me." I paused the ultrasound. "What kind of procedures?" "I do not know exactly, but they involved my reproductive system." I would wake up feeling like something had actually happened to me, not like it was just a dream. This was concerning. Rachel might be describing some kind of dissociative episodes or false memories. But given the unusual ultrasound findings, I needed to take her seriously. "Rachel, did these dreams start around the time your symptoms began?" "Yes, actually. The first dream was in early May, and that was when I started feeling the strange movements in my abdomen." I made detailed notes about the timeline. If Rachel was 32 weeks pregnant, conception would have occurred around early May, exactly when she started having these unusual dreams. "Can you describe these medical procedures in more detail?" I asked. Rachel looked uncomfortable. "Dr. Martinez, this is going to sound insane, but in the dreams, the doctors were not entirely human. They looked human, but there was something different about them. And the procedures they performed were unlike anything I have seen on medical shows or in real life." I was beginning to wonder if Rachel might be experiencing some kind of psychological condition, but the physical evidence on the ultrasound screen was undeniable. "Rachel, I need to consult with some colleagues about your case," I said. "What I am seeing on this ultrasound is outside my area of expertise. What does that mean for me and the baby?" She asked, fear evident in her voice. "The baby appears to be healthy and developing normally," I reassured her. "But the unusual anatomy needs to be evaluated by specialists who might have more experience with rare conditions." As I printed out images from the ultrasound, I noticed something that made my heart skip a beat. In one of the images, there appeared to be what looked like surgical instruments or medical devices inside Rachel's uterus, near the additional structures I had observed. "Rachel," I said carefully, "have you had any surgical procedures recently? Any medical implants or devices?" She shook her head. "No surgeries, no implants. The only medical procedures I have had in the past year were routine checkups with my primary care doctor." I studied the ultrasound images more carefully. The objects I was seeing were definitely artificial, metallic, with precise geometric shapes that could not be natural formations. Dr. Martinez, Rachel said, please tell me what you are thinking. I can see that something is seriously wrong. I faced the most difficult decision of my medical career. I could tell Rachel what I was actually seeing on the ultrasound, evidence of what appeared to be artificial devices and impossible anatomical modifications. Or I could try to find a more conventional explanation that would not terrify her. Rachel, I am seeing some unusual features that require additional testing, I said diplomatically. I would like to schedule you for an MRI and some additional blood work. But what do you think is happening to me? She insisted. I looked at the ultrasound screen one more time, at the healthy baby surrounded by impossible anatomy and what appeared to be advanced medical technology. Rachel, I honestly do not know. But I promise you that we are going to figure this out. After Rachel left my office, I spent the rest of the afternoon reviewing her ultrasound images and trying to find some rational explanation for what I had observed. I consulted medical textbooks, searched online databases, and even reached out to colleagues at major medical centers, but nothing matched what I was seeing. The next morning, I contacted Dr. Robert Chen, a maternal-fetal medicine specialist at Stanford University Medical Center. Dr. Chen had 25 years of experience with high-risk pregnancies and rare fetal conditions, and if anyone could help me understand Rachel's case, it would be him. Lisa, I have to admit, these images are unlike anything I have seen, Dr. Chen said during our video conference. The dual amniotic sac structure is theoretically possible but has never been documented in medical literature. What about the additional organs or structures? I asked. Dr. Chen was quiet for a moment as he studied the ultrasound images I had sent him. Lisa, those are not organs. At least they are not human organs. The shape, size, and positioning suggest they might be some kind of artificial implants or devices. But Rachel insists she has never had any surgical procedures. Then we have a very serious problem, Dr. Chen replied. Either those devices were implanted without her knowledge or consent, or we are dealing with a medical phenomenon that challenges everything we understand about human biology. Dr. Chen agreed to see Rachel for a comprehensive evaluation, including advanced imaging and genetic testing. However, he warned me that if the ultrasound findings were accurate, Rachel's case would likely attract attention from medical researchers and possibly federal health authorities. When Rachel came in for her follow-up appointment 2 days later, I could see that the stress of the situation was taking its toll on her. Dr. Martinez, I have been having more of those dreams, she said. But they are becoming clearer, more detailed. I think they might not be dreams at all. What do you mean? I think they might be memories that were somehow suppressed or blocked, Rachel explained. In the most recent one, I remember being conscious during a procedure, and I could understand what the doctors were saying to each other. This was concerning on multiple levels. If Rachel was recovering memories of medical procedures she had no conscious recollection of, it suggested either a serious psychological condition or something far more sinister. What were the doctors saying? I asked. They were discussing something called a hybrid gestation project, Rachel said. They mentioned that I was one of 12 test subjects and that the pregnancy would require monitoring for the full term. I felt a chill run down my spine. Rachel, did they mention anything about the baby or the unusual structures we saw on the ultrasound? Yes, she replied. They said the baby was developing normally, but that the additional structures were necessary to support what they called enhanced genetics. Before I could ask more questions, my nurse knocked on the door and informed me that there were 2 people in the waiting room who wanted to speak with me about Rachel's case. Did they identify themselves? I asked. They said they were from the Centers for Disease Control, the nurse replied. Rachel and I looked at each other. CDC involvement suggested that her case had already come to the attention of federal health authorities. Dr. Martinez, Rachel said quietly, I do not want to talk to anyone from the government until we understand what is happening to me. I understand your concern, I replied. Let me see what they want first. I met with the 2 CDC representatives in my office. They introduced themselves as Dr. Patricia Williams, an epidemiologist, and Agent David Foster, who worked in what he vaguely described as unusual disease investigation. Dr. Martinez, Dr. Williams began. We understand you have a patient with some unusual pregnancy complications. I am not sure what you mean, I said carefully, not wanting to violate patient confidentiality. Agent Foster placed a file folder on my desk. Dr. Martinez, we know about Rachel Morrison's case because we have been monitoring similar cases across the country. He opened the folder to reveal ultrasound images that looked remarkably similar to Rachel's. Over the past 18 months, we have documented 11 cases of women with pregnancies that display similar anatomical anomalies. Dr. Williams continued. In each case, the women insisted they had not been sexually active, had no memory of conceiving, and experienced unusual dreams or recovered memories of medical procedures. I stared at the images in the folder. The similarities to Rachel's case were undeniable. What happened to these other women? I asked. That is what we are trying to determine, Agent Foster replied. 3 of them delivered babies that appeared normal but had unusual genetic markers. 2 others miscarried, but the fetal tissue contained DNA sequences that do not match any known human genetic patterns. And the other 6? Dr. Williams and Agent Foster exchanged glances. The other 6 women and their babies disappeared from various hospitals around the country. No trace of them has been found. The implications were terrifying. If Rachel was part of some kind of organized medical experimentation, then she and her baby could be in serious danger. What do you want from me? I asked. We need you to continue treating Rachel normally, but we want to monitor her case closely, Agent Foster said. If our suspicions are correct, whoever is responsible for these pregnancies may try to interfere with her medical care or attempt to take her. Dr. Williams added. Dr. Martinez, we believe Rachel and these other women are victims of unauthorized medical experimentation. Our goal is to protect her and her baby while gathering evidence about who is responsible. As they prepared to leave, Agent Foster turned back to me. Dr. Martinez, it is crucial that you do not tell Rachel about our involvement yet. If she becomes frightened and tries to disappear, we may lose our opportunity to protect her and solve this case. After they left, I sat in my office trying to process what I had learned. Rachel was apparently one of at least 12 women who had become pregnant under impossible circumstances, and half of them had mysteriously disappeared. I realized that I was not just treating an unusual medical case anymore. I was potentially Rachel's only protection against whoever had done this to her. Over the next week, I continued treating Rachel while secretly coordinating with the CDC agents. Her pregnancy progressed normally despite the unusual anatomical features, but her recovered memories became increasingly detailed and disturbing. During one of our appointments, Rachel brought a notebook filled with sketches and notes about her dreams-turned-memories. Dr. Martinez, I have been drawing what I remember from these procedures, she said, showing me detailed diagrams of medical equipment and surgical techniques that seemed far more advanced than current medical technology. The sketches were remarkably detailed and technically accurate. They showed surgical procedures I had never seen before, involving the implantation of devices that looked exactly like what we had observed on her ultrasound. Rachel, these drawings are incredibly sophisticated, I observed. Do you have any medical training or background? None at all, she replied. I studied graphic design in college. But somehow I understand exactly what these instruments do and how the procedures work. She flipped to another page in her notebook. Dr. Martinez, I have also been remembering conversations between the doctors. They were not speaking English, but somehow I understood everything they said. What language were they speaking? I do not know, but I wrote down what I remember phonetically. She showed me several pages of notes in what appeared to be an unknown language, followed by her translations. As I read her translations, I felt increasingly uneasy. According to Rachel's recovered memories, she had been selected for something called the Human Enhancement Project because of her genetic compatibility with non-human DNA. Rachel, I said carefully, these memories suggest that you believe you were subjected to some kind of genetic experimentation. How do you feel about that possibility? Terrified, she admitted, but also confused because I can remember parts of the procedures and I can remember agreeing to participate. This was new information. You remember consenting to the procedures? Yes, but not as myself, Rachel explained. It was like I was watching someone else make the decision. The doctors showed me projections of what the baby would be like, how it would be healthier, more intelligent, more capable than normal human children. She paused and touched her abdomen. Dr. Martinez, what if this baby is not entirely human? What if I am carrying something that was created in a laboratory? Before I could answer, my nurse interrupted us with an urgent message. Dr. Martinez, there are several people in the parking lot asking about your patient, Rachel Morrison. They do not look like medical personnel. Through my office window, I could see a black SUV and several men in dark suits. These were not the CDC agents I had been working with. Rachel, I need you to stay calm, I said. I think the people who performed those procedures on you may have found you. Her face went pale. What do we do? I quickly called Agent Foster's number. When he answered, I explained the situation. Dr. Martinez, get Rachel to the back exit of your building immediately, Agent Foster said. We have been monitoring similar activity at other hospitals. These people are not government agents. They are working for whoever conducted the unauthorized experiments. What do they want? Based on the other cases, we believe they want to take Rachel and the baby for what they call the completion of the project. I grabbed Rachel's hand. We need to leave right now. As we moved toward the back of the building, Rachel suddenly stopped and grabbed her abdomen. Dr. Martinez, something is happening. The baby is moving differently, and I feel strange. I looked at her closely and noticed that her eyes had developed a faint luminescent quality, similar to what I had seen described in some of the other case files. Rachel, what are you feeling? It is like the baby is trying to communicate with me, she said. I know that sounds insane, but I can sense its thoughts or emotions. Before I could respond, we heard voices in the hallway behind us. The men from the parking lot had somehow gained access to the building. Dr. Martinez, one of them called out. We need to speak with you about your patient. This is a matter of medical urgency. Rachel grabbed my arm. Dr. Martinez, the baby is telling me something. It says we should not trust those men, and it says there is another way out. Another way out? Through the basement, Rachel said, though she seemed surprised by her own words. The baby knows the building layout somehow. We found a stairwell that led to the hospital's basement level. As we descended, Rachel continued to describe the strange communication she was experiencing with her unborn child. The baby is not just human, she said as we made our way through the basement corridors. But it is not alien either. It is something new. A combination that was designed to be the best of both. We reached an exit that led to an alley behind the hospital, where Agent Foster and Dr. Williams were waiting with a government vehicle. Rachel, Agent Foster said as we approached, we are going to take you somewhere safe while we sort this out. But Rachel hesitated. Agent Foster, I need to know something first. Are you trying to protect me and my baby, or are you trying to study us? Agent Foster looked at Dr. Williams, then back at Rachel. Rachel, I am going to be honest with you. We do not fully understand what has been done to you, but we believe your baby represents something unprecedented in human biology. Our primary goal is your safety, but yes, we also need to study your case to understand the implications for humanity. Rachel placed both hands on her abdomen and closed her eyes. After a moment, she opened them and looked directly at Agent Foster. My baby says it will cooperate with your research, but only if you promise that it will be raised as a normal child with a normal life. The fact that Rachel was claiming to communicate with her unborn child should have been a sign of psychological disturbance, but given everything else we had witnessed, I found myself believing her. Rachel, I said, whatever happens next, I want to continue as your doctor and make sure you and the baby stay healthy. She smiled for the first time since this ordeal began. Dr. Martinez, I think this baby is going to need a very special kind of doctor. 3 months later, I delivered Rachel's baby at a secure medical facility operated jointly by the CDC and the Department of Health and Human Services. The delivery was unlike anything I had ever experienced in my medical career. Rachel's labor progressed normally at first, but as the baby crowned, it became clear that we were witnessing something extraordinary. The child was born with what appeared to be perfectly normal human anatomy, but with several enhancements that challenged our understanding of human biology. The baby's eyes were a brilliant silver color and showed cognitive awareness that was far beyond what newborns typically display. Within hours of birth, the child was making eye contact, responding to spoken language, and even attempting to communicate through what seemed like telepathic connection with Rachel. "Dr. Martinez," Rachel said as she held her daughter for the first time, "she wants me to tell you that she appreciates everything you did to keep us safe." I should have been skeptical, but after everything we had witnessed, I found myself accepting that this child was capable of communication that went beyond normal human abilities. The team of specialists who examined the baby found that while her DNA was primarily human, it contained sequences that did not match any known genetic patterns. These enhancements appeared to improve cognitive function, sensory perception, and possibly even longevity. Agent Foster and Dr. Williams kept their promise to treat the child as normally as possible. Rachel and her daughter, whom she named Elena, were relocated to a small town where they could live relatively normal lives while being monitored and protected by federal agents. "The people who did this to you," Agent Foster explained to Rachel, "were part of an international organization that believed they were preparing humanity for some kind of future challenge. We never found them, but we have no evidence that they are continuing their experiments." Over the following years, I remained Elena's pediatrician and watched her develop into a remarkable child. She was extraordinarily intelligent, demonstrated empathy and understanding far beyond her years, and possessed abilities that could only be described as enhanced human capabilities. Elena could learn languages instantly, solve complex mathematical problems intuitively, and even seemed to have limited precognitive abilities. But despite these extraordinary traits, she was also a normal child who loved playing with toys, watching cartoons, and spending time with her mother. Rachel adapted to motherhood with the same strength she had shown throughout her pregnancy. She learned to help Elena manage her abilities while ensuring she had as normal a childhood as possible. "Dr. Martinez," Rachel told me during one of Elena's checkups, "sometimes I wonder if whoever did this to us was right about preparing humanity for something. Elena seems to understand things about the world that I never could." "What kind of things?" "She talks about problems that humanity will face in the future, environmental challenges, technological developments, even social issues. It is as if she was designed to help solve problems that we do not even know we have yet." Today, Elena is 5 years old and continues to amaze everyone who meets her. She attends a special school for gifted children, though she requires additional support to manage her enhanced abilities. She has formed friendships with other children, despite her differences, and shows every sign of developing into a well-adjusted individual. The case files on Rachel and the other women remain classified, but I know that at least 3 other enhanced children have been born and are being raised in similar circumstances. These children represent something new in human evolution, not natural development, but carefully designed enhancement. Sometimes I wonder about the organization that created these children. Were they preparing humanity for challenges we cannot yet imagine? Were they trying to accelerate human evolution? Or were they simply conducting experiments to satisfy their own scientific curiosity? I may never know the full truth about who modified Rachel and why, but I do know that Elena represents hope for the future. She possesses capabilities that could help solve problems, heal divisions, and advance human knowledge in ways we are only beginning to understand. As Elena's doctor and Rachel's friend, I have witnessed the birth of something entirely new in human history. These children are not just medically unique. They may be humanity's first step toward becoming something greater than we ever imagined possible. Rachel was right from the beginning when she insisted she was not pregnant in any conventional sense. What she carried was not just a baby, but the future of human potential. And sometimes, the most impossible things turn out to be the most important discoveries of all. Elena often tells her mother that there are others like her around the world, children born through similar circumstances, and that someday they will all meet and work together to help humanity. I hope she is right, because if these children represent our future, then the future looks remarkably bright.